Welcome once again. My name is Simon Stanley, and thank you so much for taking time to watch this tutorial on antimalarial drugs or treatment of malaria. If you have not subscribed, please do so and hit the notification button so that you may be able to continue finding notification when a new video has just come in. So quickly, let's jump into the lesson. So today we're going to do treatment of antimalarials, and specifically I'll be tackling quinine, as much as I've heard that it's spaced out, but you might be in a situation where you may be able to be forced to use one, or maybe in your health facility you're still using. So as much as it has been phased out, as I've heard from us, you still need to know how it is used, so that you may be able to manage the patients on such a light drugs well. So let's dive in. Okay. So antimalarial drugs include 1, the 4-methoxyquinolones. That includes quinine, which is given 10 milligrams per kg body weight per dose of 8 hours IV or oral. So in severe cases of malaria, you may combine quinine with clindamycin. You might also combine quinine with tetracycline. You might combine mefloquine plus artemisinin. Mefloquine is also used alone for prophylaxis for those people maybe traveling to places where there is malaria endemic zones. So in another group is 4-aminoquinolones, which includes chloroquine, amodiaquine. Another group is 8-aminoquinolones, which includes primaquine for eradication of erythrocyte forms of PVAX, malaria, PVVAX and P. ovale, and camitocidal against Plasmodium falciparum. Sulfonamide combination is another group. So sulfadoxine or pyrimethamines, for example Fanzida, which was used especially in IPT, that's treatment, prophylaxis treatment of malaria in pregnant women. You also have sulfamethylpyridiazine or pyrimethamine, for example metachelafins. So metachelafin names. So artemisinin is another group, derivatives from artemisinin annual, artemether e.g. palantha, artesunate, a semisynthetic artemisinin e.g. asmax, dihydroartemisinin, the active metabolite of artemisinin, for example cortexin. So another group of antimalarials or examples of this drug include artemether plus lumefantrine, also called cotam, artesunate quine, also called artequin, artesunate plus aminodiaquine, also called larimol, artesunate plus sulfamethylpyridiazine plus pyrimethamine, also called coaranite, dihydroartemisinin plus paperaquine, also called cortexin, artemisinin 62.5 milligrams plus papyramine 375 milligrams, also called Artequick. So these are some of medications that you might easily come across, especially in health facilities, in your working areas. These are some of medications that are usually common for treatment of malaria. If we can move on, we also have biquinamides and other combinations, which includes proquinine milligrams plus atovaquine 250 milligrams. The trade name is Malaron. Proquinine alone is used in prophylaxis. So you can use proquinine alone in prophylaxis when you are traveling from places or areas where there is no malaria, and then you are going to places where it is known for malaria, being malaria zone. You can have this medication and then you'll not be able to contract malaria. So another group is 9-phenylmethanol salts, halofenrin, also called halfan, that's the trade name. So lumpendrin used only in or it can also be used in combination. So what are some of the antimalarial drugs? It includes quinine and related agents. For example, we have another group called chloroquine, have another group called amodiaquine, have pyrimethamine, have sulfodiaxine, have proquinine, have mefloquine, have atovaquine, have pyrimaquine, artemisinin, and derivative halofenrin, toxicity, and clindamycin. So today, basically, I'll only be able to talk about the first group of drugs, that's quinine and related agents. So whereby we shall be able to do brief history about quinine. We'll also be able to do about pharmacokinetics, mechanism of action, adverse effects, and how you can manage them, and some of the symptoms of these adverse effects. So quinine and related agents. So quinine has a long history stretching from Peru and the discovery of the singoma tree and the potential use of its bark to the current day, and a collection of derivatives that are still frequently used in the prevention and treatment of malaria. So quinine is a 4-methoxyquinolones, is an alkaloid that acts as a blood zygodicidal and weak gametocidal against Plasmodium vivax and Plasmodium malariae. It is especially useful in areas where there is known to be high levels of resistance to chloroquine, mefloquine, and sulfur drug combination with pyrimethamine. So places where it has been established that there is too much resistance of chloroquine or mefloquine, so you can easily use quinine in the treatment of malaria, rather than leaving someone with this malaria or continue treating with the chloroquine, and whereby it will not be able to work. So another group, quinine is also used in post-exposure treatment of individuals returning from an area where malaria is endemic. Maybe you have traveled from one area where there is no known malaria history, but now you've gone to places where there is malaria, and then you are now back. The first drug of choice to be given for post-exposure is quinine. So Quinmax and quinadine are the two most commonly used alkaloids related to quinine in the treatment of or prevention of malaria. So Quinmax is a combination of 4 alkaloids, that's quinine, quinadine, syngoin, and syngondiadine. So this combination has shown in several studies to be more effective than quinine, supposedly due to a synergic action between the 4 syngona derivatives. So quinadine is a direct derivative of quinine. It is a stereoisomer, thus having a similar antimalarial properties to the parent compound. Thus quinadine is recommended only for treatment of severe cases of malaria. So unless someone is in severe cases of malaria, don't give quinadine, because it's more stronger compared to. So what are the mechanisms of action? So quickly let's look at mechanisms. So as an alkaloid, it is accumulated in the food vacuole of the Plasmodium species, especially Plasmodium falciparum. So it acts by inhibiting the hemozoins by recrystallization, thus facilitating an aggregation of cytotoxic heme. So I've been able to make highlights to some of the words that are very, very vital when discussing or maybe describing mechanism of action, as a blood zygodicidal agent than chloroquine. So let's move on. So what is pharmacokinetics? So doses can be given by oral, IV, or IM route. The oral bioavailability of quinine is 76 to 88% in healthy adults. Quinine tablet may be administered without regard to meals, generally 10 mg per kg, body weight per dose every 8 hours as a routine given. So both, it can also be given both IV and oral. So quinine is moderately protein bound in blood of healthy subjects ranging from 69 to 92%. So quinine is metabolized almost exclusively via hepatic oxidation, cytochrome P450 CYP pathway. Quinine is eliminated primarily via hepatic biotransformation. Approximately 20% of quinine is excreted and changed in urine because quinine is reabsorbed when the urine is alkaline. So renal excretion of this drug, the drug is twice as rapid when the urine is acidic than when the urine is alkaline. So what are the adverse effects? What are the adverse effects of this drug? So you have quinine can be adversely affect almost every body system. So the most common adverse events associated with quinine use are a cluster of symptoms called sponsin, so which occurs some degree in almost all patients taking quinine. So you need to be on the lookout when you're giving these drugs for these symptoms. So in mild adverse effect of sponsin, what are the symptoms? So the symptoms include headache, vasodilation and sweating, nausea, tinnitus, hearing impairment, vertigo or dizziness, blurred vision, and disturbance in color perception. So when it becomes more severe, you will notice that the patient starts to vomit, to diarrhea, to have an abdominal pain, to feel deafness, unable to hear, blindness, and disturbance in cardiac rhythm or conduction. So most symptoms of syngoma are reversible and are resolved with the discontinuation of the quinine. So when you're using this drug and then you notice that these symptoms have started appearing to your patient, so the best thing to do, the best medication to do, is just to withdraw or stop administering the drug, and the patient will be able to be good on his own. So let's move on. So what are the effects in hematological blood? So in hematological, you have hypoproteinemia. That means this patient may easily bleed out to death. Hemolytic uremic syndrome, also called HAS, thrombotic thrombocytopenia purpura. You have black fever, aplastic anemia, and lupus and coagulant. So neuropsychiatric includes headache, diplopia, confusion, altered mental status, seizures, and coma. Then in dermatological, you have cutaneous rash. Respiratory, you have asthma, dyspnea, and pulmonary edema. In cardiovascular, you have intravascular block, irregular rhythm, QT prolongation. Then in GI, you have nausea, vomiting, diarrhea, abdominal pain, and gastric irritation. So if you have a patient on this drug, please be on the lookout for these symptoms. So what are effect in hepatic or in the liver? So granulomatous hepatitis. It can also cause hepatitis. It causes jaundice. It causes abnormal liver function test. When you do a lab test, you'll find abnormality. So metabolic quinine can cause hypoglycemia through its action of stimulating insulin secretion. That's why someone on quinine will always be encouraged to at least have a bit of glucose. So musculoskeletal, you have myalgia, muscle weakness, renal, hemoglobin, and on a renal effect, you have hemoglobinuria, renal failure, and then renal impairment and acute interstitial nephritis. So I think for today, we'll be able to reach here. Thank you so much for taking time and going through this. And for a quick reminder, if you haven't subscribed or liked, please do so in this continuous purpose of production, so that we may be able to notify you whenever a new video is on. Thank you. See you